Welcome, everyone. We are the Why Do You Vote Social Action Campaign, and today's call is Vote for Universal Healthcare. The purpose of our Tuesday morning chats are to connect and engage and empower, and it was so wonderful hearing from each of you who has joined as a guest speaker. We see the importance of healthcare in everybody's lives, and people who've lived overseas have had different experiences. And I really encourage us to talk about voting this year and voting for healthcare. Our campaign has 7 issues it's a nonpartisan nonprofit campaign, and we are focusing on these 7 issues. And as I said today, 85% of Americans desire universal access to healthcare. Since the pandemic, we've seen the need. And, the heart of our campaign is asking people why they vote, and it's an invitation to take action on social media. And I just want to quickly go through that, to turn out more voters these days, we need to disrupt despair and get people excited. Stop talking about the candidates and start talking about the future we want and the issues we all care about. And the hopeful news is that, a lot of people think young people don't care, but they're wrong. In 2020, 54% of Gen Z voted, and there's 40 million Gen Z voters eligible. So we need to engage them and get them, ours is a social media campaign, and we're trying to get videos about voting for the issues we care about. The top 3 reasons that young people vote, is that it's a responsibility, it can affect the outcome, and voting is a right. So the idea is to stop talking about the candidates and start talking about the issues we all care about.
I vote for women's choice because we need autonomy over our own bodies. Why do you vote?
I vote because democracy is an important part of the American spirit. Why do you vote?
I vote because the people who came before me made so many sacrifices to make my vote count. And that's why I vote. Why do you vote?
I vote because I want kids to be safe at school. Why do you vote?
I vote because of marriage equality. Why do you vote?
For our environment, to hear our planet, to hear your rights, to hear for everything. So that's the reason I vote. Why do you vote?
I vote because I believe in universal healthcare for all. Why do you vote?
I vote because I care about marriage equality and people exercising their rights. Why do you vote?
I vote because action is the antidote to despair. Why do you vote?
VOTEE.
With that, I just also want to share that on the weekend of September 14th, we are going to host the Spark the Vote Social Media and Film Challenge, where we encourage everybody here and beyond to make videos, especially about healthcare. Let people know that we're going to be doing this. And with that, I would like to invite Chuck, our featured speaker on healthcare. He's the president of One Payer States. He's been working on this a long time, and I'd love to get an update on what's happening across the country and what we can do and how we can encourage people to vote this election and to help push this issue forward. Thank you, Chuck.
Thank you. Thank you so much, Holly. And I appreciate the opportunity to share both good news and challenging news with really fellow Californians. I grew up in California from age 13 to 21, went to high school in San Diego, college in Santa Barbara and Berkeley. And my activism started really right there in San Diego, knocking doors, working for an environmental focused city council member. I was sort of his default campaign manager at age 13. And there was actually at that same time, there was a nuclear safety initiative, Proposition 15. Some of you may have a memory for that going back to the mid 70s. And then I went on to work for a state senator, Gary Hart in Santa Barbara, ACLU. I worked for Ron Dellums, did military casework for those aggrieved in the military. And then I went on and moved to Washington, D.C., worked for former California Senator Alan Cranston. I was actually his personal aide. I was his driver. He was number 2 in the Senate, so I actually had the opportunity to drive around and get to know Washington, D.C. while meeting people like Steve Jobs, like before he was a known, entity with, with Apple. So that was really a tremendous way to kind of get myself immersed in national politics. And then I stepped away from the electoral arena, I should say, congressional offices, and then I started getting more involved in campaign or electoral politics, as well as issue politics. I got involved in the peace and justice efforts. This is during the Reagan years, and then during the even-numbered years, I'd work on Senate campaigns. So I worked for Tom Harkin of Iowa, Tim Wirth of Colorado, Paul Simon of Illinois, and got those folks elected. So, and then I went back to graduate school. And when I went back to graduate school in Colorado, I organized graduate students. And one of the major reasons we did that was to get health benefits for graduate students. The graduate students at Colorado did not have any clear representation. They didn't have a standing governance board. They didn't have a constitution. We established all that within 3 years. I don't mind saying that also got me in a lot of trouble as a graduate student, because that kind of organizing is looked down upon in higher education. And to sort of update that story, most recently, I organized beginning 6 years ago at University of the Arts in Philadelphia. Some of you may have seen it in the news. Our school was shuttered on 1 week's notice, the end of May of this year. And the major reason that they closed it was because of our success in establishing a union. We unionized the faculty. And what's really fascinating about that work is that we were able to bring people together in a way that nobody thought possible. And every step I've taken along the way, whether it be anti-apartheid through University of California, organizing graduate students at Colorado and getting healthcare benefits and a voice or at the budget table, getting all these members of the U.S. Senate elected, helping those in the military, mostly Black and brown soldiers and female soldiers, find their way. At each step along the way, people said, "Oh, Chuck, you can't do that. You can't do that. You can't do that." I get tired of hearing people telling me what I can and can't do and what we together can and can't do. We've always, always, always come together when the chips are down, when the times are most difficult. And you can't help but look at the world that we're in right now and the recent Supreme Court decisions, the Chevron decision, and then this absolutely crazy decision, Trump versus US, that has essentially emboldened the former president and has given monarchical powers to the presidency, moving us one step closer to a dictatorship. Rather than being overwhelmed by that and being disempowered, I take your moniker, Holly, which is that through our connection, through our engagement, we are going to empower ourselves. We're going to vote on our values, not just our issues, but our values. We're going to vote on how we connect with one another, on how we see what I call the intersection of issues, right? So I organize not only on healthcare, and I'll get to that in a moment. You know, I realize that's the focus of the call, but I want to give you sort of a conceptual framework as to how I do the work I do, both as an academic and an activist, in bringing together, primarily medical professional people with this group, One Pair States, but just thinking about the intersection of issues. We call healthcare, we could create the most perfect healthcare system in the world, but if we don't have a healthy society, right? A society that has access to quality food and housing. Most of you here have said that you have what you think is pretty good healthcare. And I don't know if you've actually had to test that through a crisis, because I've gone through a crisis, major crisis, actually. I'm blind in my left eye, advanced glaucoma. This eye went completely south when I had 2 retina tears. And what I found out is that my health insurance was inadequate. And this is something that I found out when I was actually in the crisis of the emergency of a healthcare issue. And so the vast majority of Americans do not realize that, much as they may think that they have good healthcare, when it really comes down to it, the vast majority of us are underinsured. We may have insurance, but the vast majority of us are underinsured. Unless we have deep pockets, unless we're in the 1 to 5% who have that capacity, to weather that kind of a storm. And even there, if it's an extreme situation, even there that can wipe out your savings. So we are a healthcare insecure society, and it's not an accident. And in fact, it's not an accident that virtually all of our institutions have become thoroughly corporatized and have focused more on the bottom line than on serving those people who need education, who need food, who need housing, who need healthcare. And in the healthcare sphere especially, it's the most egregious form of wealth extraction, is what I call it, wealth extraction. Somebody in the introductions made a reference to steward healthcare. One of the people I'm working with on Capitol Hill here in Washington, D.C. is Senator Ed Markey. Ed Markey has agreed to champion our state-based Universal Healthcare Act. I put it in the chat. It's HR 6270. He'll be introducing it shortly in the U.S. Senate. Ed Markey of Massachusetts, U.S. Senator. One of the reasons that he wanted to bring this bill to introduce it in the Senate was that this legislation is designed to give states the power to regulate these private equity firms, these predatory private equity firms that do not care about healthcare. They simply care about extracting wealth wherever they see opportunity. And that's what's been happening from Wall Street, is that Wall Street has been going after these community hospitals, these private hospitals, and they've been extracting wealth and running them into the ground. My former hospital in Pennsylvania, in Philadelphia, Hahnemann Hospital, same thing happened. It was actually a California private equity guy who went in, bought the hospital, and then slowly just drained the resources out of the hospital. This is a 150-year-old hospital, the center of a community in North Philadelphia. And he literally wrecked the hospital. And that's exactly what's happening in Boston with Steward Health. And that's what's happening around the country as well. So we need to recognize the challenges that are coming at us. And that has to do with the privatization of healthcare. Many of you may know or may not know that that this Medicare, so-called Medicare Advantage program is actually drawing people into the Medicare private insurance side, the private insurance side of Medicare. And it's so much cheaper than going with Medigap, which is the way that you can make up for what's deficient in the current Medicare system. And in doing so, it's a bait and switch. What happens is that once people actually need healthcare, they turn to their health insurance companies and they find out that they don't have the care that they thought they had signed up for. So Medicare Advantage is a bait and switch. We call it Medicare Disadvantage. And what it's doing is it's allowing private insurance companies to drain the Medicare Medicaid fund so that by the year 2030 to 2036, these are the projections by economists, that Medicare as we know it will be gone unless something is done about that. And so what can we do? What are we doing? Well, the group One Payer States, we work with all sorts of healthcare justice organizations who are working at the national level and the state level. And we're working on pushing back on this privatization of healthcare and health insurance that's happening right now. Radically, it's happening. So we're active with groups like Social Security Works, Public Citizen, Be a Hero, as well as numerous other organizations like Physicians for National Health Program, Healthcare Now, Labor for Single Payer, as well as the California campaigns. There are 7 single payer groups in California. I don't know how much you know about your own terrain in California, but for the most part, they work together, but there are splits and fractures. There was a Senate Bill 770 that actually split the movement in California. And that's the kind of thing that we've got to stop. We've got to stop the circular firing squads. We've got to get people on the same page. You may disagree tactically with what your brothers and sisters are doing in this healthcare sphere, but keep your powder dry. Do not attack others. You've just recently introduced, again, a single payer bill in California. And I don't know how much folks know right about single payer, but single payer is a reference to how healthcare is paid for. It's a reference to how it's paid for, and it creates an efficiency of a single payer pool. We use the term one payer as a way of saying the same thing without blowing people out of the room, because my job in Washington, D.C. is not simply to win over half of the Democratic caucus that signed on with Pramila Jayapal's National Medicare for All bill, but it's to win over the other 50% of the Democrats who can only see as far as expanding the Affordable Care Act, and then winning over more conservative Republicans who believe that states should be the place where innovation can take place in terms of healthcare reform. So we are building bridges, we are educating, and we are winning over support among Republicans, both in the House, and we're making progress in the Senate. It's a quiet campaign right now. We're going to have to win this election. We're going to need to sweep this election in 2024. There's no question about it. We can leave the political party names out of the equation, but unless we get a sweep in this election, it's going to be very difficult to push forward, even with our legislation, which is what we call enabling. It allows states to create efficient funding mechanisms, right? A single payer pool or a one payer pool at the state level, so that you can have what we call Medicare for all or universal healthcare for all at the state level. Our theory of change is that this is the way that we're going to achieve universal healthcare. This is the way Canada, another C word. Canada was able to get to universal healthcare through a single province, that of Saskatchewan. Tommy Douglas, who led that province, is regarded as the George Washington of Canada. Tommy Douglas, Saskatchewan, Canada, back in the 1960s, they modeled a solution, and in doing so, the rest of the provinces said, we want a piece of that. And Canada eventually created a national Medicare for all system. We believe that California, Oregon, Washington, Minnesota, New York, Maine, Massachusetts, those are sort of the leading states right now. That out of that mix, we get 1, 2, 3 of those states to model a solution. Then it's going to become very obvious to our national leaders that we've got the solution. The way we got to the Affordable Care Act, you might know, was through Romney Care in Massachusetts. What we want to do is to create a Medicare for all model that then becomes the model for how we create that national system. So I don't know how much further you want me to go, Holly. I have some slides I can share, but I know that this is a 12 to 12:30 call or 9 to 9:30 Pacific call. Do I want to stop and take questions? I did drop some resources in the chat. I did so on your spreadsheet. And I can be reached for any further conversation that folks want to have.
This is so wonderful. I mean, we do like to let people who want to go deeper stay on the call and go deeper and connect. So if you, I'd love to open it up for questions and to have you share slides. Is there a hand? If anybody has a question, do you want to put it in the chat or speak up? I know I had one. I came to this issue because I worked on 2 films, 20 years ago about about the pharmaceutical industry. We had made Side Effects with Katherine Heigl and Money Talks, Profits Before Patient Safety. And it's been exciting to see the beginning of a break in the pharmaceutical pricing and, especially Medicare for All Part D price, like that there's no competitive pricing, so we see some progress. And I love, hearing what you said about Canada. It's like, you would have thought that they'd had universal health care forever, but it really is only since the 60s and with one province. And so I love that. And I love that you're bringing up the intersectionality as you see in our campaign. So does anybody else have questions? Otherwise, we could see your slides, and I'd love to hear about what's going on, the progress in each state, and that or more about how we can support California in this next,
I think I saw Bill. Is that Bill? Your hand up, Bill? Do you want to unmute?
Yep. Yes, I was just typing it in, but thank you. I'll ask. Sure. So, I would like to know specifics about what I can do today, tomorrow, next week, and next month to help win the election based on everything you've said. I totally support universal health care and have, for decades. But we have to win the election. And I understand how you don't want to go into politics, and that's fine. But as long as those 2 goals converge, I'm all in and I want to help and I want to start now.
Perfect. Yeah. Yeah. And just so that you know, we are a nonpartisan organization, as you are, this group. And so I want to honor that. But I don't think there's a question about which political party right now has the greatest prospect of helping us achieve what we need to. So I don't even need to say it out loud. But the one way I think about this bill actually is bottom-up politics, which is actually working from the bottom of the ballot up, is to get people excited about candidates down ballot. I've got my own opinions on Joe Biden following that debate the other night. It was not easy. That was not easy to watch, and I think our best prospects actually in terms of voting are getting people excited about down ballot candidates, or what I call bottom up candidates. Bottom up, thinking about democracy as a bottom up process, as participatory, as cultivating the new leadership of the future. That's the exciting thing. The way that we go forward with strategy, I'll talk about this in a few minutes when we're done with the Q&A, is really visioning the future, actually seeing that future where we all have healthcare, housing, quality education, et cetera. And then we ask ourselves, how did we get there? Reverse engineer the question. How did we get there? What were the steps we needed to take? So I'd like to spend a few minutes with you on that if people are interested. It's how I keep myself focused at a time of really high stress. Capitol Hill is not an easy place to operate. Members of Congress and their staff, they all openly admit that it's a dysfunctional institution. So that brings me back again to local politics, Bill. It brings me back to thinking in terms of really getting excited about local candidates, and they represent the future. And then once you get people out to vote, they're going to vote up and down the ballot, right? That's, I think, one way to stay focused. A lot of my friends are thinking, I'm angry with this president, and I'm going to vote third party. I'm going to protest, blah, blah, blah. Like, I think that one way to get people steered away from that is actually to think about politics as bottom up, as really cultivating the future and really realizing the vision of a justice for all society.
Actually, I want to share a video we just started working on. We're going to launch soon, just about that. 1 second.
Yeah, Mark has a question, I think, too.
Yeah, hold on 1 second. Here we go.
States, we have one president.
Wait, here we go.
In the United States, we have one president, 50 governors, 100 senators, 435 representatives, 1,400 mayors, 1,973 state senators, 5,413 state representatives, 89,004 local governments. Local races matter. Vote down ballot.
Yeah, exactly. We're trying to change the conversation just from the top of the ticket to the issues and down ballot. So I love that we're talking about this. The question.
Absolutely.
Yeah, and Dennis also had one in the text first. Dennis had asked, how many people are needed in a state to create a viable single payer system? I've always presumed Vermont's problem was that there were less than 1 million people in the state.
Right. Yeah, that's a really good point, Dennis. Vermont, actually, its population is 600,000, the same size as Bucks County, Pennsylvania, where I raised my children. It is too small, and Governor Shumlin made the mistake at that point of not reaching out to bring the federal healthcare dollars into the state to create that efficient one payer or single payer pool. And again, that's the design of our legislation. It's somewhere between 50 and 70% of all healthcare spending is federal healthcare dollars. For California, think about this. I lived in California when Jarvis Gann came down, the taxpayer revolt. And the reality is that Californians are going to have to tax themselves to pay for what the gap between what is currently covered through the state and what will need to be covered, additionally. But bringing those federal healthcare dollars back means that the price tag will be dramatically far less and a much easier lift politically. So the leading state right now, technically, is Oregon. And Oregon has 6 congressional districts, and you do the math, that's about 3.5 million people live in Oregon. New York is maybe the second state right now because they do have the stars are aligned and they don't have the challenge in California of having essentially to tax yourselves to pay for the difference that you need to get to actual universal health care. So it would be ideal to get a state like New York or a California or a Texas, but a big state that can really demonstrate the leveraging power of numbers, so that you bring that force of numbers so that you can buy medical equipment much more cheaply, pharmaceuticals much more cheaply, it's much more efficient, and so forth. So yeah, your point is very well taken, Dennis, that it was a problem for Vermont, its size, but it was also the political problem of not thinking ahead and about bringing those federal healthcare dollars into the state and create a consolidated one payer or single payer system. Thank you for the question. Mark?
Yeah, I just wanted to say, Chuck, that you brought up Medicare Advantage, and there's a lot of dangers ahead because President Bush initiated that program saying it would save Medicare money. In reality, Medicare Advantage is costing more per patient than original Medicare. And the for-profit companies who have these plans, particularly United Healthcare, which has 4 million enrolled, and now over 50% of Medicare recipients are in Medicare Advantage plans.
Right.
They're actually, instead of saving money, the Medicare Advantage plans are enriching the for-profits and draining the Medicare trust fund.
Exactly. Yeah. And it's understandable why people sign up for Medicare Advantage, because the price tag, the premium price tag to get into the system is so much cheaper than Medigap. I think it's something like just above $2,000 for Medicare Advantage on an annual basis, as compared to close to $5,000 for Medigap. And for a lot of people who are marginally on the edges, and we're living in a society where our middle class is shrinking. I mean, I'll tell you, I've shared with you a little bit about my personal story, but I have no health insurance. I turned 65 in September of this year. So I avoid, banana peels with great diligence. I have to be very careful, being blind in one eye and so forth. But my healthcare story is one that I need to share. We need to come out of the dark and tell people about our struggles and our problems, because you wouldn't know it just looking at me that I have this disability. But to your point, Mark, absolutely. We were lied to back in 2003. And you can go back and find a YouTube. I think there was a 60 Minutes episode done on it. And Billy Towson was the one from Louisiana who led that vote in the Congress. And rather than sticking to the traditional 20-minute window for members to vote, he held the vote open for 3 hours until they twisted just enough arms to get that bill passed, the Medicare Part D bill under former President George W. Bush. So you're absolutely right. It was a bait and switch. We were absolutely lied to. The numbers that were told that it would cost something like $400 billion, now it's into the several trillions of dollars that's cost, and the number continues to climb. So 100%, Mark. Yeah, this is something we have to reverse. And I think that our best chance, this is my view, as an historian, somebody who's been in practice at politics for a long time, is that we have the best chance of achieving it in more progressive states, bluer states, where we can then model the solution. Washington, D.C. is broken, and unfortunately, the medical industrial complex has got a grip on most of the Democratic chairs of committees, when the House is in majority or the Senate is in majority. It puzzles the hell out of me how we're not getting serious discussion here in the U.S. Senate. It's way off the radar. It's a majority Democratic institution, and yet we're not having any serious discussions about moving forward. But I think that it's a much easier lift for members of Congress to let the states move forward. And for me, that's the path of least resistance, and that's the best chance we get to move forward much more quickly. So thank you, Mark. Hope that answered your question.
Thank you. This is really helpful. I'm learning so much. I'm excited that people are engaged. And I love, focusing on the state level at this moment is critical. Does anybody else have any questions or comments?
So what I did also drop a link to the OECD. Those are the advanced industrial countries. And you probably know that the US is 34th out of 34 on most measurables in terms of healthcare outcomes. And yet we spend north of twice as much as the average advanced industrial country. And most of that money just disappears in the form of that wealth extraction that I mentioned to you, the administrative costs of the medical system, just waste, fraud, abuse, excess profit. And frankly, I think it's important that we step back and remind ourselves that the CEOs of these insurance companies and the pharmaceutical companies, they're doing their job. Actually, they're doing their job. They're serving their investors, their investor class. The way that the problem in their society is that Wall Street drives the way our institutions are run. Like, what was your profit in the last quarter? So that's basically how far most people can see is only quarterly. That's why I'd like to just introduce you briefly, if you're up for it, is just a quick way to look at visioning and how we can think in terms of how are we going to achieve this justice for all society, a society that's good to each other. And it starts actually with a book I read when I was a teenager. Some of you may be familiar with it, Edward Bellamy, Looking Backward. This book was written in 1887, published in 1888, and it was published in dystopian Boston. This is during the height of the Gilded Age, right? This is when society was very sideways, even worse than it is today. And the author, Edward Bellamy, what he did is he created a fictitious character and he transported him to the future, to the year 2000. And he went into a deep sleep. He had sleep issues, and somebody came in from the outside, helped him sleep, and he slept until the year 2000. You just sort of have to roll with this a little bit. But the point is that when he wakes up in 2000, he looks around and sees a society where people are taking care of each other. And he begins to ask, how did we get here? How did we get here? And basically, that's what it is that I want to share with you. And I'll do it very quickly, and I will happily send it to you, Holly, and people can take it and use it as you will. It's open source. Everything that's on One Pair States, our communication strategy, the way that we are developing our own larger strategy is available to anybody. We want to win. We're not monetized at all. I'm living on a Social Security check and a pension check. This is how we roll. We're a volunteer organization. We don't want to be part of the problem, which is organizations get started and then all of a sudden it's all about the money. It's all about staffing. It's all about keeping the roof over your head. And then the organization that started with a great vision and mission goes sideways. We're committed to making sure that we're all about participating with as many people as possible and sharing what we learn. So if it's okay, do I have the screen share?
Yes, you do. Please do.
And I will do this very quickly. It's a 16-point document. It's a lot, actually, but it's something that I encourage people to take a look at in your more leisurely time and really think about what it is that we need to do as a society, because there's very little what I call strategic thinking and planning among these organizations. The organizations they come into existence and then their primary purpose is simply to self-perpetuate. And that's not going to win the day. We need to connect and we need to build. So let me see if I can find it here. And sure. What I'll do is I'll send you this Word document as well as I have a PowerPoint, which is an easier way to look at it. It's an easier way to look at it. But what I want to do is just say that there really are 16 steps. And this comes out of 5 decades of organizing and conversations with organizers, especially during the beginning of the pandemic. During the beginning of the pandemic, I said to myself, I want to revisit everything I've done and really understand why it is that I do what I do and how I can do it better and actually be more intentionally strategic. And it really does begin with envisioning success. You have to see it, I believe. You have to see it. You have to see that, and it has to be at the center of your vision. It has to be at the forefront of how you think about where we're going. And it's a daily exercise. I mean, there are days I wake up and it's a lot harder to do it. I mean, following these Supreme Court decisions and that debate last week, it's a lot harder. So we're all human. But then the next step is to reverse engineer and just ask yourselves, how did we do what we did? What was it involved? And that begins really with defining what strategy is. And strategy is not the same as strategy means that you're thinking in terms of all these steps below. Let's just leave it at that. If you're answering the question why, not how, we're asking the question why in terms of what it was that we did. Some of you are familiar with the SWOT analysis, strengths, weaknesses, opportunities, threats. It's a discussion for internal discussion about where are we strong, where are we weak, where are our opportunities, where are threats, what are our challenges, what do we need to recognize, and be honest with yourself. And then this relates to the work that you're doing, Holly, specifically, and that's connecting what I call the people, the politics, and the policies. And I say in that order, because you've got to build the relationships first. You've got to build that respect, trust, hope, and empathy. And then think in terms of our politics. How do we connect, like I said, with these organizations that become siloed and isolated? How do we get them out of their silos? How do we get them to connect and see themselves as intersectional and also co-equal? We can't say my issue is more important than your issue. That blows people out of the room. We need to recognize that everybody's issue needs recognition as equal importance. If you don't have a roof over your head, what else matters, right? So building relationships, horizontal organizing, and then linking our issues in a way that makes it clear that we're connecting with people at all levels. You know, it's like it's cross-class connection. It's really connecting people and with the concerns that they have. And then we need to be smarter. And this is the work. It's not easy at all. And I'm a college professor. So I taught for 32 years and I was getting older while my students were staying the same age, right? So the idea here is that you need to develop new leadership and decision-making models that adapt to the diversity of younger people in particular, because we're not going to win until we bring younger people's voices and decision-making and power to the forefront. So one thing I would ask people to do is to bookmark September 7th. We're doing our 6th Intergenerational Summit. I'm dropping a new bit of information on you, September 7th Intergenerational Summit, and it will focus on the election, and it's going to highlight young people's voices, diverse younger people's voices in connection with older people. But that's really a key to developing new leadership and decision-making. And then communications. It's both internal and external. We have to be respectful of ourselves. And I'll tell you that there are a lot of Democratic Party groups in which a lot of people are dismissive of people who express concerns about Joe Biden and his capacity to win this fall. I think we need to have that conversation respectfully. We can agree or disagree, but a lot of the messaging is basically dismissive, and it doesn't help. You know, we need to embrace each other and listen. Like a good friend of mine said, we were born with 2 ears and one mouth for a reason, right? 2 ears and one mouth. And then so the communication externally as well. We need to connect ourselves with others in terms of our shared values and the power of story and choosing language. I'm very careful about this in talking to people on Capitol Hill, as well as other social justice organizations, in making sure that they feel welcome, that I'm listening to them, and we're working on finding common ground, and we build forward going with that. And then identify, define, and call out our opponents and call in our non-supporters. There are groups in this healthcare organizing space that are very critical of the work that we do. We've actually been accused of being racist because we support state level work. And for them, that smacks of Jim Crow. And nothing could be further from the truth, but nonetheless, that people do take license with that and do attack. And that's what I call the circular firing squads as well. We've got to stop that. And then just being mindful of your organization, how you need to develop yourself, whether it's on fundraising a little bit but mostly in-kind, resources, and also to chart out timelines for short-term success, midterm, and long-term success. We need to have short-term and midterm successes to get to our long-term goals. And also just be mindful of how we measure, quantify, and qualify our goals, like being very mindful of how it is that we think in terms of what our goals are and what it is that we're achieving. And then ultimately, how do we bring it all together? We won by winning on the outside and the inside. What we say in the streets, in the suites, offline and online, in rural, suburban, exurban, and urban America, as well as in the capitals, both state and national. Paint that picture. What did that look like? So I'll happily share this. This is the product of a lot of conversation. So I can't expect folks to just soak it all up, but I want you to see here that strategy involves not doing one thing and then repeating it over and over again. I think it's and some famous person said that that's the definition of insanity, right? Is repeating the same thing over and over again. And it's Albert Einstein, I believe, and thinking that somehow the outcome is going to change. So I'll stop there and see if folks have any final questions, and then feel free to follow up after the meeting. Holly?
Thank you. This was wonderful. Yeah. And again, everybody, please share your information if you want to stay connected. I don't have everybody's info, but we'd love to be able to share the video after the call. We will also put it on our website on our events page. And again, we'd all love everybody to participate in our Spark the Vote social media and film challenge the weekend of September 14th. So Chuck, I'll definitely follow up with you about that and your September 7th intergenerational summit. I love that. But are there any last questions? That I think that PowerPoint would be great with, but reading through that list was really helpful. Yeah, I'm a big visioner and to manifest and create. And I think when we do it collectively and intersectionally and intergenerationally, we can get there, even though it feels daunting.
Absolutely. Like I might be able to find it and drop it in the chat if it's available. So
yeah, if you can drop it in there, then I can already put it in the spreadsheet, which would be great.
I don't know. Can you copy PowerPoints?
You can, if it's a Google PowerPoint, you can actually publish it and then share that link.
Yeah, I'll do that after, but I did find it. I did find it.
Wonderful. Well, thank you so much for all of your wisdom and insight. And I just love your attitude and spirit around this. And I look forward to collaborating further in the future.
Yeah.
Oh, let me mute. I see Dennis needs some muting there. Okay, well, with that, next week we'll have our next coffee chat is the topic. Let me look. We hope you'll be back. Next week it's democracy, and we're going to have John Boniface from Free Speech for People, Cindy Black from Fix Democracy First, and Professor Chiara Torres Bellisi, who wrote Corporatocracy. That's a mouthful. But this definitely getting big money out of politics, which is our democracy topic, totally aligns with why we are where we are with healthcare and pharmaceuticals, because it's all about, the influence of big money. So if we can, intersection these ideas and get out the vote, we can have an impact, especially as we vote down ballot and bring the right people up.
Yeah.
So
one other thing I did drop a chat in there. I as an educator, somebody who got my PhD in American and German history, I think a lot about the parallels between where we are right now and the Weimar Republic as they went into National Socialism. And so check out my anti-fascism website. It gives you it's a 31-point definition of what it is. And I think once people kind of wrap their minds around that, it really does make sense. To me, this election, it needs to focus on anti-fascism, because this is where we're heading right now if we don't hit the brakes in a very significant way. And so thank you so much, everybody. I appreciate your open-mindedness and all that you do and spreading the word. Fellow Californians, Ro Khanna, from the Bay Area, we're going to get our bill done, and we're going to get all this other justice work done. Just believe in yourselves. Thank you so much.
All right. Thank you, everyone.
Thank you.